Welcome to Richard and Greg, a channel dedicated to discussion, debate and argument on a whole array of topics. Today we talk to Greg about the current coronavirus figures, especially as we've reached more than 5 million cases worldwide, of which the US has now reached 100,000 deaths. We also discuss Dominic Cummings, an issue which has hit the headlines in the United Kingdom. So let's go over to Greg. Welcome to Richard and Greg. It's Monday morning on the 25th of May 2020 at 11:48 a.m. GMT +1. Today we're going to talk about the coronavirus, an update, but also what's been hitting the news headlines, particularly in the United Kingdom. And if we have time, we'll just touch briefly on what's been happening in America. With worldwide cases now in excess of 5.5 million, and American deaths, once it's published, the figures aren't quite published yet, certainly will exceed 100,000 today, and the United Kingdom exceeding 36,000. Is there no end to this toll? So let's go over to Greg and find out what's on his radar. Good morning, Greg.
Good morning, another lovely sunny day. And most of the population are celebrating a bank holiday, which is pleasant for them. And in reality, many of them would be at home anyway, even if it wasn't bank holiday, because the country is largely on a voluntary form of lockdown, enforced in some areas, but it is slowly, in baby steps, being relaxed. As Richard has said, we're now over 5.5 million reported cases. We have 347,000 deaths. America has 1.6 million cases reported, and a total of, it'll be 100,000 by now. Yesterday's figure was 99.3. So it's well on the way to 100,000. Interestingly, America has seen fit to ban inward travel from Brazil, which I'm a little confused about, in that Brazil currently, ignore the figures because they don't mean anything in terms of numbers without looking at the size of the population. So let's look at the total number of cases per million in Brazil, which is 1,719 per million. And their death rate is 107 per million. Meanwhile, America has a number of cases of 5,098 per million, and 300, that's 3 times as many deaths per million. So I'm not quite sure why Brazil has been singled out. Bear in mind that Spain has 6,000 cases per million and 615. They've even managed to do double the number of deaths per million that America has. 6 times as many deaths per million as Brazil has. I freely admit Britain isn't doing exactly wonderfully, with 542 deaths per million. Italy with 542 also per million. At least we aren't the worst. We're very close to it. But Spain seems to be leading that field. But I can't understand why Brazil has been singled out for blocking by the Trump administration. But let's move on. We know the figures are fairly meaningless. They are just an indication of more the efficacy of the reporting system of the country concerned. Because I really cannot believe that India has 3 deaths per million and China has 3 deaths per million when America has 300. Britain has 542, as does Italy. So I'm sorry, it just doesn't stack up. 101 people in every million are reported as having the COVID-19 virus in India, yet America has 5,098. I can't add it together and make it make any sense whatsoever. I'm not sure that these figures are telling us very much. I think the death toll in almost every country is being underestimated. We know that when Britain checked against our average deaths for the same period in an average year, our figures were found to be pretty wildly inaccurate. And we also found that we just weren't correctly taking consideration of people who died in care homes or in the community without going into hospital. And we also know that in some areas, hospitals are under pressure and they are tending to record deaths as COVID-19 when the main cause of death was other than COVID. It is hardly surprising that somebody in their last days of terminal cancer is likely in a hospital to pick up a virus. Viruses are opportunistic. The person actually died of cancer. They died with COVID, but not of COVID. So bearing those facts in mind, I think we can safely move on. America is having problems, mainly because nobody seems to agree within the administration, and clearly many states do not agree with the central administration. It is one of the great drawbacks of a country with 330 million people. It's much harder to get a consensus opinion or consensus fact, especially a country where supposedly they value their freedoms so greatly. They seem to have the freedom, or want the freedom, to be able to commit mass self-destruction, which is the risk of returning to normal life too soon. Because at the end of the day, we don't have a vaccine. We don't really know how this virus works. We do know that the virus would appear to be mutating at quite a rate, in that new outbreaks in China are presenting very different symptoms to the original outbreak of late November. And also, during the outbreak, we've looked at the figures in Britain and the symptoms, and in some people, the virus would appear to attack the pancreas, the liver, and other major organs. But in other people, it leaves them completely alone and attacks the lungs and respiratory system. These appear to be very different viruses. So we haven't got much of a clue as to how this virus is working, despite the many claims. And we have within the American administration quite clearly people at loggerheads over issues. We even have people now accusing Fauci, who was the main advisor to Trump, of lying about details. It's shown us more about human personalities and behaviors than it has about the virus so far. It's not a simple issue. It is not an easy issue to deal with, because this is the first major pandemic that we have had in the lifetime of anyone in politics. The last one was the Spanish flu, which ended in 1919, having killed 50 to 100 million. We had the possibility of a major pandemic with SARS and with MERS, but for no reason we understood, they very rapidly petered out. This one doesn't look as if it's going to peter out. Yes, I think it's going to change, but that change is going to prove problematic for us. And I believe that we're not going to have a clue at finding out a vaccine that is fully tested and reliable within the foreseeable future. We failed to find a good vaccine for AIDS. We haven't got a vaccine for the common cold. We haven't got a vaccine for HIV, Ebola, green monkey disease, Marburg's disease, or a host of others. And we haven't got a clue how to make one. We haven't got a means of preventing cancer. We don't have a means of preventing coronary disease. To think that we're going to have a vaccine by Christmas, as some politicians are very glibly asserting, is clearly an absolute nonsense. Pure fluke might give us one, but it sure won't be because we're being clever at it. It is unlikely we'll have a vaccine, even if one was discovered by Christmas. We wouldn't have a vaccine that was distributable amongst any major nation on the planet. And we've already agreed that for a vaccine to be effective, we are going to need to vaccinate on a mankind-wide basis. And it would appear that the world has agreed that vaccine will be supplied, fully funded for every country on equal grounds. That means we have to make not just 67 million doses and administer them for the people of Britain, nor 330 million doses for the people of America. Not even a modest 10 million doses for the people of Sweden. We are going to have to produce 8 billion doses for the people of the world and administer them. That isn't going to happen inside 5 years, not a prayer. So I'm afraid it's a case of, unless we're very lucky and the virus dies out with no understandable reason, as did SARS and MERS, and as did the Spanish flu, having killed between 50 and 100 million people. It just died out. Unless we're very lucky and this virus dies out, we're going to have to learn to live with it. This is going to be a matter from here on in, if we are going to have any sort of economic progress or any sort of economy, country by country or worldwide. It's going to have to be administered with common sense and minded of one's own safety and the safety of others. Don't sneeze all over people. Don't cough without covering your mouth. Sneeze and cough into your elbow, not into your hands, which will then spread the disease on surfaces. Self-isolate responsibly. Yes, there will be the odd dishonest and corrupt individual who takes advantage and claims that they're self-isolating because they have symptoms. Just as there are millionaires who are furloughing and getting the government to fund their staff who they have furloughed. That furlough money from the taxpayer was designed for people who couldn't afford to pay and survive, not for people to use as a convenience. We're going to have to learn to live with this virus, just as we do with HIV, the common cold, annual flu, and a host of other viruses. Not to mention the bacterial infections like malaria and the like. We will also, as we approach a vaccination for the virus, have irresponsible idiots trying to claim it is a plot by this one, that one, or the other one to inject people with compliance fluid of some sort. It's nonsense. Thousands of children have died because of the irresponsibility of those who have said that vaccines against measles, mumps, and rubella cause autism, Down syndrome, etc., without one shred of evidence, without a single double-blind test, without any competently peer-reviewed research.
Okay, Greg, thank you for that. Now, what's hitting the headlines, certainly in the United Kingdom at the moment, is Dominic Cummings. Now, for the benefit of those who don't know who this guy is, can you please sort of educate us and tell us what the issues are and your view of how he's being treated?
Dominic Cummings is a wealthy young man with, dare I say, a wealthy marriage that also backs him. He is, and has been for some years, being considered by some to be something of a political whiz kid in terms of advice and campaign management. He was a prominent campaign leader during the Brexit campaign that helped to lead us out of the trap of being members of the European Union. He worked with Boris Johnson and many others of all parties who had realized the damaging effect of the European Union and how damaging it was for democracy. He was seen as something of a genius by some. Many heavily criticized him, but anybody who stands out from the crowd tends to be heavily criticized by those who have a different opinion. He's been vilified by a number of organizations that lost the debate and lost the vote on the issue of the European Union. And when the Tory party came to power with Boris Johnson decided to take advantage of Dominic Cummings' competence as a campaign manager, policy thinker, and blue sky thinker, and employ him in Downing Street as a special advisor. Dominic Cummings was one of the team within Downing Street that drew up the plans and the structure and the policy of what we know on a daily basis of lockdown for COVID-19 control. It would seem to have worked superbly in that our hospitals were not overrun, as was predicted by most of the scientific evidence that was put forward and most of the medical evidence that was put forward. He was part of the team that devised the concept of the Nightingale hospitals, which, had the medical and scientific advice been correct, looked very much as if they would have saved the day. The aim was not to avoid people getting the disease, because we knew we couldn't do that. The aim was to prevent there being a peak in the disease, so that we managed the number of people presenting at hospital at any one time to being that which our National Health Service was capable of dealing with. This we have done and was achieved excellently. During the period of the lockdown, probably due to the fact that Cummings, Boris Johnson, and others, in their role as leaders and policy makers, had little choice but to meet face to face with many people, Dominic Cummings' wife contracted the COVID-19 virus. In hindsight, it's very easy to be wise after the event. And she did not receive it badly enough to go to hospital. However, Dominic Cummings also isolated because he was in contact with somebody. They had a 4-year-old child. They lived in London, where Dominic or his wife would have had to have gone out shopping on a regular basis, would have had to have been confronted by the press every time they left their home. And you only have to look at the press pack at the moment, utterly irresponsibly, mobbing him as they stand there shoulder to shoulder, trying to look clever and get answers. He went intelligently, in my opinion. He got in his car, removed himself from the risk of spreading the disease amongst the people he was in contact with in London and he would have been forced to be in contact with. He drove 260 miles to his parental home. He did not visit his parents. He did not visit his sister or any other member of the family. We are reliably told, and we must accept this is reliable information. He isolated himself in a property his family owns, and his sister and his niece did all the shopping for Dominic Cummings, his wife and child, and I believe it is only one child, it might be more, but I only know of one 4-year-old. In traveling to the area, the 260 miles, it is perfectly easy to fuel a car. We all do it on a regular basis without any interface with people by using a credit card or a demand card of some sort at the petrol pump. You don't have to speak to anyone. You don't have to come in contact with anyone. You can act totally responsibly and maintain your isolation and continue your journey having filled your car with fuel. He remained in that house, I understand, for 14 days. He was very fortunate that neither he nor his wife wound up in hospital, and probably due to responsible action, neither he nor his wife died of this disease, which is killing a lot of people. He had positioned his 4-year-old child where, if he and his wife had been suddenly rushed into hospital, his sister had agreed to collect the child and take care of it. This could not have happened in London. He was protecting other members of the public. He was protecting the press corps, who would have been utterly irresponsible in trying to make the news rather than responsibly reporting the news, and would have encroached on his space when he had to go out shopping. And he had provided for his child as any parent responsibly would. We are assured that he made this one journey. He has told the Prime Minister he made the one journey. He responsibly isolated in the spirit of isolation. It bears no resemblance to people claiming that they wanted to have the opportunity to hold a relation's hand while they died or were in hospital. No similarity. Dominic Cummings, in my opinion, acted responsibly, intelligently, and within the spirit of the rules. There was no police investigation, despite the fact that apparently somebody in a mischief-making effort tried to get the police to investigate. It was not investigated. It probably will be now, because there is so much clamoring. The police will be investigating so as not to be criticized for acting in one way with one group and another way with another group. Dominic Cummings, however, if he lied about this, and he made several journeys, then I totally agree that he should be summarily dismissed. And if there is a provision within the law, prosecuted for having lied to his employer, lied to the public, and lied in office whilst on the public payroll. However, we don't seem to do that very often. Tony Blair is still around, and he hasn't been prosecuted for his lies to politics, the people, and the monarch regarding Iraq. Dominic Cummings, if what we hear is correct, did nothing wrong. This is just a witch hunt by politicians of the opposition who are merely concerned about their ability to seize power at the expense of anyone. It's just a self-interest power grab by them. And members of the media who are just professional mischief makers trying to make the news rather than report the facts. A fact which the public have started to realize, and you will notice that newspapers, news programs, and the like, their audiences are collapsing.
On that note, Greg, on that note, we have to end it. What I will say is that amongst the political, what we call chatterati, they are claiming there was more than one trip, and we shall see if that actually comes out and whether that was the case. Greg, thank you very much. Those listening to this podcast, by all means, please share your comments, whether you think Cummings should be fired or left alone, and whether you agree with Greg that this is a witch hunt by the media. Greg, thank you very much.
My pleasure, and stay safe.
We hope you enjoyed that discussion, and if so, kindly subscribe to our channel and press the bell sign so that you are notified of our videos as and when they are published. And also in the description box below, we place links to certain books, articles, and programs which you may find of benefit, and for which we will receive a small commission should you purchase through our link. And this will help support our channel and to enable us to develop it further.